So you want to try to limit your activities out in public, such as limiting those to going to the grocery store, going to the physician's office after you've called ahead for the first time, picking up medications from the pharmacy. But I also want to say that shouldn't stop you from experiencing the increased warmth in the weather. So feel free to take a walk, go biking. But if you're in playground areas, you don't want to congregate with others, families. You want to maintain, again, social distances, but feel free to go outside and catch some fresh air. So those are the things that we can do as citizens to keep all of us safe and protected. If you do find yourself not feeling well, you notice a fever, a cough, shortness of breath, or other symptoms that you are concerned about, please stay home. And when you stay home, you even want to isolate from others in your family. So try to quarantine yourself to one room, not share utensils, wipe down door handles, and other things that families normally share in their day-to-day activities. And if you do that and you're still not feeling any better, please call your physician office and get some direction about do you need to come in, what the potential things you need to do in preparation if you need to come to the office. What we want to do is make sure that we keep the pipeline to healthcare open. We want to take care of those who need us, and we're here and we're available for that, be it in the outpatient ambulatory side or on the inpatient hospital side. And the way that we make sure that those pipelines to healthcare are open is by calling ahead, letting people know what your symptoms are so we can prepare for where you're best served. So if you need to go to the emergency room, we can actually make sure that that's done well. And also if you need to come into the doctor's office. If it's an emergency, and emergencies will still happen despite this infectious crisis, if there's an emergency and you need to call 911, you call 911 and you tell the dispatcher that you might have symptoms that you feel might be consistent with the COVID virus. I'm having shortness of breath, cough, fever, etc. And that way, when the ambulance comes, they can be appropriately prepared.